Molly, I can't breathe. I'll get the EpiPen. Mark, start the car. 8% of children suffer from food allergies. They range from a rash to life-threatening. For a child who suffers with a life-threatening food allergy, fast action and proper use of an EpiPen are the difference between life and death. I've worked in a pharmacy for the past 10 years as a CPHT. I know firsthand how the proper use of an EpiPen can make the difference in allergic emergencies. We will discuss the signs and symptoms of anaphylaxis, proper use of the EpiPen, and the steps to follow after use. Knowledge of anaphylactic symptoms are the first step in treating an allergic emergency. There are 6 general symptoms of anaphylaxis. They vary in severity from person to person. A skin reaction such as a rash or hives, flushed or pale skin, a feeling of a warmth, a sensation of a lump in your throat, a swollen tongue and lips, a constricted airway, weak and rapid pulse, nausea and vomiting, and dizziness and fainting. The most important of these symptoms are those of the swelling of the face and constriction of the airway. Knowing what to do and the steps to take are vital in a severe allergic reaction. Most people know what their allergies are and they try to avoid contact with those things. There are occasions when people are exposed without their knowledge. If you or a family member has an allergy to insects, food, or medications, talk to your doctor and see if an EpiPen is right for you. EpiPens are available in pediatric and adult doses. Each pen comes with instructions and a trainer to help you become familiar with its use before a stressful situation arises. In the event of an allergic emergency, make sure that your EpiPen is accessible. If the person is unconscious, call 911 first. Remove the pen from the case. Remember not to place your fingers or hand over the black tip. Hold the EpiPen where the black tip is pointed downward. With your other hand, remove the gray safety cap. Hold the tip towards the outer thigh. Swing and jab at a 90-degree angle. Hold firmly for 10 seconds. Remove and massage the area for 10 seconds. If a red flag appears, you have given the correct dose. Place the pen back into the storage container. If the person is conscious and the threat of the reaction is gone, head to the nearest doctor or emergency room. The symptoms may return, so it is important that you seek medical attention. If medical help is over 20 minutes or more away, take an additional pen. The injection may need to be repeated. Upon arrival at the doctor, make sure to tell them that you have received an EpiPen injection. You should practice with the provided training pen to become familiar with the steps of proper use. The injection is only helpful if administered correctly. The more familiar you are, the more likely you are to be able to react and use the pen appropriately. Other things to remember that are just as important as the proper use of the EpiPen is storage. Make sure that your EpiPen is stored in its case between 59 and 86 degrees. Make sure that you check the expiration date of your EpiPen. If the pen is expired, the potency of the drug can be effective and will be of no use to you in an emergency. Periodically, look at the clear window to check for discolored or solid particles. The solution should be clear. If it is not, replace the unit. We all hope that we are never placed in a situation where someone's life is in our hands, especially if it is a loved one or a child. For a trained professional, use of an EpiPen is second knowledge. If you have a family member with a severe allergy or you own an EpiPen, you should be able to react just like that professional. The only way is to practice before an emergency situation arises. And as with most things in life, knowledge is your best resource.